This short video explores anatomical terminology and body planes, the essential tools for understanding human anatomy. Anatomical terminology is a language used to describe body parts and the relative position of body parts for communication. Anatomical terms are based on a standard body position called the anatomical position. In this position, the body is standing erect with arms at sides and with face, palms, and feet facing forward. Before discussing further, let's divide the body into two parts. Axial portion. This refers to the main part of the body, including the head, neck, and trunk. Appendicular portion. This refers to the limbs attached to the axial portion, including the arms and legs. This slide shows some of the common terms for different parts and regions of the body. Take your time to go over them several times to memorize these terms. Next, let's go over some of the common directional terms. Make sure to remember that these terms describe the location of a structure compared to another structure in the body. Superior refers to a location closer to the head, while inferior refers to a location away from the head and closer to the feet. Make sure to remember that these two terms are only used when referring to structures in the axial body portion. Examples: the heart is located superior to the diaphragm, and the stomach is located inferior to the diaphragm. Anterior or ventral describes the front of the body, while posterior or dorsal describes the back of the body. For example, the sternum or breastbone is anterior to the heart, and the vertebral column is posterior to the heart. Medial refers to a location closer to the midline of the body, while lateral refers to a location further away from the midline and towards the side. Examples: the eyes are lateral to the nose and the heart is medial to the lungs. Proximal refers to a location closer to the trunk of the body, while distal refers to a location further away from the trunk. Make sure to remember that these two terms are only used when referring to structures in the appendicular body portion. For example, the shoulder joint is proximal compared to the elbow joint, while the wrist joint is distal compared to the elbow. Superficial refers to structures located near the surface of the body, while deep refers to structures located internally within the body. Examples: skin is superficial compared to the muscles, and bone is deep compared to skin. Finally, ipsilateral describes structures on the same side of the body, while contralateral describes structures on the opposite side of the body. For example, the right arm and right legs are ipsilateral, while the right arm and left legs are contralateral. Next, we have body planes. Body planes are imaginary flat surfaces used to anatomically divide the human body into distinct sections for descriptive or diagnostic purposes. There are three primary planes. 1. Sagittal plane. This plane divides the body into left and right portions, running parallel to the midline. If the plane passes directly through the midline, it's termed the median or mid-sagittal plane. If it's off-center, it's referred to as a parasagittal plane. 2. Frontal plane, also called coronal plane. The frontal plane divides the body into anterior or front and posterior or back sections. It's perpendicular to the sagittal plane. 3. Transverse plane, also called horizontal plane. The transverse plane divides the body into superior or upper and inferior or lower sections. It's perpendicular to both the sagittal and frontal planes, cutting across the body horizontally.